It's the largest undertaking in Billings Clinic history. Thursday's announcement of the hospital seeking to become a Level 1 trauma center is expected to cost $30 million, but officials say it's all worth it because if approved, they'll be the only Level 1 in a 500-mile radius.
What it means is that essentially we're going to save lives.
There was a palpable excitement inside the Fordham Health Center Thursday as Billings Clinic leadership announced their intention to become Montana's first ever Level 1 trauma center.
Thank you, Dr. Gerd.
Board of Directors Chairman Keith Cook said it was when the board saw this map showing the region's obvious gap that made them get serious about it.
We also recognize that if Billings Clinic did not make this commitment to our region, somebody else would. So it was a pretty easy decision for us.
Billings Clinic became Montana's first Level 2 trauma center 30 years ago. To get to Level 1, they basically need to get bigger. More operating rooms, a new surgery-only intensive care unit, more surgeons. January's announcement of the first general surgery residency program in Montana will help that. The $30 million funding campaign will help with everything else. Bozeman businessman Tim Sheehy, who was deployed multiple times to the Middle East on military service, gave the first $1 million.
It's an interesting fact. I was closer to a Level 1 trauma center in Iraq and Afghanistan than anyone is in Montana.
Sheehy was also one of several to share their own personal experience with traumatic injuries. Another was Director of Clinical Care Christy Baxter, whose father suffered a bad ATV accident in 2017.
They weren't planning to ship him out, and they showed me a copy of the CT report, and it just so happened that I had the direct dial to a thoracic surgeon here in Billings, who I called. We quickly got it arranged for him to be here. I've often worried that what about the next patient who doesn't have a critical care nurse daughter who knows that the skill set is not there to manage? So that's part of my why.
That is another of the clinic's motivations, to expand trauma care at all of its regional facilities in hopes of getting a patient to a highly trained provider within the golden hour.
You have about an hour before you can really start getting sick after injury. And unfortunately, it's very difficult to achieve that. And so what we're trying to do is cut down that time to help those facilities and the first responders that help these patients.
And hopefully eliminate having to fly patients hundreds of miles during the most critical time.
We have had instances where patients have not made it because they had to go just that little bit more. And if we can provide the same care as all those centers and they can stay close to home, that's the best.
Casey Conlon, MTN News.